Welcome to UofL Today with Mark Hebert. This is the show about all the great things going on at the University of Louisville. So for the next half hour, we'll be talking a lot about research, entrepreneurship, and what's going on at the Speed School of Engineering and other places on the campus that are interesting, I hope, or as you would think, for the next half hour or so. So, on the show today, there's a faculty member in the Speed School of Engineering who's turned into quite the prolific inventor. John Naber will be here to talk about his implantable spinal device as well as a sensor that could revolutionize the care of nursing home patients. And speaking of inventors, the University of Louisville has hired 3 entrepreneurs to help UofL faculty get their inventions to market. Josh Nichols is one of those entrepreneurs. He's here with Will Metcalf, who's the Director of Strategic Initiatives with the Office of the Executive Vice President for Research and Innovation. Josh, good to see you. Welcome to the University of Louisville.
Thank you. Nice to be here.
Only been here for a couple of months. Will, good to see you.
Thanks, Mark.
All right. So you guys are working together on a project. What is this project you two are working on? Will, you want to describe it?
Yeah, so about, 6 months ago, this state of Kentucky, the Cabinet for Economic Development, put out an RFP for a project called Regional Innovation Support for Entrepreneurship. And we got together with the Louisville Healthcare CEO Council, an accelerator here in Louisville called Accelerate Health, and the Chamber of Commerce, and put in a response to that RFP. And so the idea is, how do we grow an innovation economy here in Louisville, Kentucky? So a knowledge-based economy, leveraging the resources at the university, our big corporate industry, which largely is healthcare here in Louisville, as well as tech-based. And how do we do that to support entrepreneurship and innovation? And so that's what we're doing. And so part of that, the university's part of that, is the University of Louisville does about $180 million a year in research expenditures. That's kind of a wonky phrase, right? What does that mean?
What does that mean? Yeah.
So that means that people in labs, researchers, scientists, postdocs, in labs every day doing science, coming up with new inventions, engineering inventions. It could be a healthcare-related invention. It could be a new way to diagnose a disease or treat a disease. It could be a therapeutic. And then once that invention happens, we go through the intellectual property protection process. So that means we get a patent on it or a copyright. And then we try to license that technology out to a company. That could be a small startup company, or it could be a large, strategic partner like think of a Cook Medical.
So you're trying to get the invention to market one way or the other. Okay.
Exactly. So using that research and those inventions that come out of the university's research activity, and then work with entrepreneurs to grow an economy here in Louisville based upon this technology that's happening. So a lot of this research is funded by the National Institutes of Health or the National Science Foundation, so federal agencies. So growing, once the federal government makes that first investment, if you will, in the research and innovation, and then kind of continuing that going. And that's where we bring in guys like Josh Nichols here sitting next to me, another guy, Jeff Cummings, who's another entrepreneur, and then Charlie Miller to help us. We're calling them entrepreneurs in residence to help us find the path to market for these inventions.
All right. So, Josh, what is an entrepreneur in residence? What's your job with the University of Louisville now?
So it's a lot of things. We're helping the university look at its portfolio. There's a lot of really exciting technologies that are in there now, many of which are healthcare related. That's my background. And so, I'm focused principally there. And I think that we live in a city that has a strong healthcare background as well. And so we're really playing to the strengths there. As an EIR, we also are looking at opportunities where we can turn these into companies that are independent of the university, taking the technology and the ideas that have been generated here and the success of their validation, and then finding what is the recipe around that company or around that technology that becomes a company. Who would need to be involved, what kind of financing would need to be there for it, and then what is the value proposition out in the marketplace.
So you're basically trying to help UofL faculty members take their inventions to market.
Yeah, exactly.
In essence, what's your background? How do you know how to do this?
So my background started academic. I have a PhD from Vanderbilt in molecular neuroscience, also an MBA, and then since then, for the last 20 years, I've been working in the life sciences industry across medical devices, molecular diagnostics, and some therapeutics. I also work with a venture fund out of Cincinnati called CincyTech, and also the Cleveland Clinic, leading a company for them.
So you got your fingers in several different pods, huh?
I do, but I like, as we were talking yesterday, I really like being busy, and I think there's a lot of opportunity here to take technologies out of the university and drive them into companies.
Again, that's Josh Nichols, who's one of the entrepreneurs in residence at the University of Louisville that we've just hired, one of 3, and we're also talking with Will Metcalf from the Executive Vice President for Research and Innovation Office at the University of Louisville. And this whole entrepreneur in residence, this EIR program, the acronym. There's two other guys, and they are who?
So one is a guy named Charlie Miller, and he's a products development, a technology development guy. So he's software background, and he came out of New York, and he recently moved back to Louisville, as a lot of people do, to be with family. So he's got a young family here, and he was a co-founder of a company and vice president for product at a company called TouchCast, which is basically a gaming company, a software gaming company out of New York, and they've done really well. And what we wanted to do with this whole program is to pull people out, right? So people like Josh and like Charlie, who hadn't really been engaged in the ecosystem here in Louisville, but have a tremendous amount of skills and experience that we could pull out and leverage for growth here in Louisville.
And to help our faculty.
And to specifically help, from my perspective, is to help our faculty commercialize technologies.
Right.
And so that's what Charlie's going to do. Is he's got this software background. We often have, applications we need to develop for phones that have medical use, right? But we don't necessarily have that ability to develop a product that's customer focused or friendly, that people are going to want to use. We know the science and the technology, our inventors do, but how do you build a product out of that that's going to be usable and understandable to the consumer? And that's where Charlie's experience is.
And you got one more guy too, right?
Yeah, and then Jeff Cummings actually started at UofL in biochemistry about probably 20 years ago, and then went back and got his MBA and has been running and launching companies for about the last 20 years in a variety of spaces. That's from the refining industry to most recently he came from a company, Car Keys Express, which was
Car Keys Express.
Yeah, so they reprogrammed the keys, the key fobs.
So if you lock yourself out of your car, you can go to them.
Well, if you lose your key,
you lose your key.
Yeah, they can build a new one. It's a business to business model. It's not to consumer.
Gotcha.
But anyway, he's got a great experience around operations and finance for high growth companies.
Okay. All right, Josh. Who are some of the folks you're working with? You've been here for a couple of months?
Yeah, about a month now.
Okay.
And we started out this, and the LEAP program was very helpful in providing what amounted to basically
We should say what LEAP is.
Yeah.
That's the
So
acronym,
it's the
right?
Louisville Entrepreneurship Acceleration Partnership. And this is the proposal we put into the state, which is partially funded by the state, partially funded by each one of the partner organizations. But it's a group of 4 entities. So UofL, Louisville Healthcare CEO Council, which basically is the CEOs of 12 healthcare organizations based here in Louisville, big ones, $80 billion in revenue annually. Healthcare Focus Accelerator, Accelerate Health, and then the Chamber of Commerce.
GLI.
Yeah.
GLI. Okay. All right. So sorry we interrupted.
No,
we just had to explain what
so
LEAP
that's
is.
a great introduction. So, working with LEAP, we did a sprint through a number of the technologies that are really of high interest, and those again I gravitated toward were in healthcare, and I think that there's several in therapeutics, there's few in devices, and I think most interesting to me at this moment is some technology around machine learning and how machine learning can be used within healthcare.
What is machine learning? What is that?
So good question.
I'm a common guy. I have no
no.
idea what machine learning is.
So essentially it is if you can provide a data set of conditions, symptoms, and diseases to a machine and have the inputs correctly that reflect what that disease state is, you can have trend lines or trends that are developed out of that where in the future, based off of a training set, you can say, you're not symptomatic yet, but we see enough of these changes in you to suggest or to diagnose that you have a certain condition.
You're headed towards diabetes, or you're headed towards whatever.
Well, you actually
dementia
nailed
or
it.
whatever.
Yep, you actually nailed it. So one of the technologies that we're really, really excited about is one for diagnosing diabetic retinopathy. So this is a disease that really remains latent for a long period of time in diabetes patients. So we're aware of the fact that these patients eventually can develop retinopathies, can lose vision. But the problem is that for many, many patients, they don't have access to either a primary care or ophthalmologist who can routinely screen them for the disease. And there's a technology here by the Albaz Lab that has been developed and a platform that we're looking at pairing with it that would give greater reach into the community, giving greater reach into rural areas, helping more people and patients with diabetes in Kentucky get the screening that they need so that they can avert, that later stage of diabetic retinopathy.
So that's one of the folks you're working with at the University of Louisville, and so the funding for that, I know Dr. Albaz at Simon Albaz has gotten some federal funding for some of his research. Is that one of the things, Will, that he's gotten some research money on?
Yeah, he's gotten quite a bit of funding for this specific activity, as well as just more broadly. He's into using machine learning, or commonly referred to as AI, artificial
Right.
intelligence, to develop imaging-based diagnostic tools. So this is all types of diagnostic tools, including for lung cancer potentially, as well as diabetic retinopathy, which is the one Josh is talking about. Ranging to renal disease and all kinds of other diseases. So it's using this kind of basic platform that he's developed, this skill set that he has, this huge postdoctoral student group that he has in his lab that can apply these skills across the board, right? And so now that we've gotten this portfolio, this patent portfolio, and then we've got Josh in that can see where investment dollars are going, right? So where are venture capitalists or angel investors, and then large strategic companies like IBM making investments in this space, or Google is also very interested in AI for healthcare. And so where is the money going in this space, and how can we attract some of that here to Louisville, right, to take our technologies forward and then maybe grow a whole industrial base around this type of technology,
Right.
That's the idea.
So
Because if you get one hit in this, it could
It's a big
change
one,
the
yeah.
trajectory of the whole city.
Yeah.
Agreed.
Yeah. So Josh, you're out telling them how to raise money, basically, is what you're trying to help with, right?
Yeah, that's a part of it.
Or where to find money.
Where to find money is a part of it. What I think right now is we need to take this kernel of an idea and say, okay, there's real opportunity here. But now, what are the other elements that need to be brought into it for it to really be a technology that can be placed into the community, be put out there and help people? And once we have the aspects and elements of that pulled together, I think we'll be in a really good position to help this company raise money.
When you talk to folks from the city of Louisville, I think folks at the University of Louisville as well, who are in this market to be inventors and to try and be entrepreneurs, I think they would say this is a great city for entrepreneurship. You got the basics at the University of Louisville. You got the organisms in place that can make this a great city for entrepreneurship. But the problem is there aren't a lot of venture capital funds here in Louisville, that they have to go elsewhere. So is that part of the problem that you're trying to help these faculty members from UofL overcome to get that point where, you got this great subculture here of researchers doing great stuff, but they just can't find the money to move it to the marketplace? Are you the help with the bridge? Is that kind of the idea?
I think that's partly the issue. I think there's also opportunity to really take the technologies and polish them in a way that they make sense to investors. There's not as much capital as there are in other areas of the country, but we can certainly make a dent in moving technologies out of the university and turning them into companies. And that may be through seed capital, maybe through innovation grants that the university is providing. There are opportunities here that are really exciting. And if we can get them through those early points of validating it, showing that there's promise for this technology, we will find the capital. Capital will follow.
Okay. And what are you hoping to get out of this, Will? What's the EVPRI office, the Executive Vice President for Research and Innovation, hoping to get out of this?
It's a good question, right? So it goes back to trying to get our inventions out into the world, right? So, and that's, so when we get that, when that happens, right, when we have an invention that's licensed to either a startup or a big company, there are royalties that come back to the university, both the inventor and the university, to allow us to continue this cycle, right? To fund innovation grants, which can stimulate new ideas and move those ideas out into the world, so that those people, so that then these inventions can help people. Ultimately, is what it's for, right? So we're doing healthcare mostly here, or it could be also potentially like a renewable energy play, like solar energy technology or new catalysts to help in production of biofuels, these kind of things that ultimately will grow our economy, but grow our economy because there's a place in the market and a need for these services and these technologies, right? So that's what we get is, there's revenue that comes back.
Right, the university gets something out of it.
Yeah,
in
but
cash.
that's mostly just to stimulate this cycle and grow as a university, grow our research base and our ability to commercialize.
All right. Go ahead, Josh. You want to add one final note?
Yeah, teed off on that. This is a virtuous cycle. In investing in these early stage companies, there are things that happen that are indirect, right? You're able to pull in more technology folks. You're able to pull in entrepreneurs. You create an environment that will continue to stimulate and grow the local economy. So I think there's a lot of things that are very exciting about what we're doing now within the LEAP program.
All right. Well, again, Josh Nichols, welcome to the University of Louisville as
Thank
the EIR, the Entrepreneur in Residence, and Will Metcalf, always good to see you.
Yeah.
And when a doctor is doing spinal surgery to correct a deformity, they need a way to measure the strain on the rods going in a person's back. That's just one of the inventions the UofL engineering professor John Naber has come up with during his time at UofL, and he is, as I talked about earlier, a serial inventor, and he's got lots of gadgets here he's throwing in front of me that he's going to show me here in just a second. John, good to see you.
Great to be back, Mark.
Good to see you. All right, you've got all sorts of stuff. Let's talk about, in general, what do you teach at UofL, and what are you teaching students? We'll go there first, and we'll talk about some of your inventions.
Sure. I'm in the electrical and computer engineering department. I worked in industry for 10 years before coming to UofL, and my area of expertise is designing circuits. So the classes I teach at UofL are digital integrated circuit design and analog integrated circuit desigin.
Okay, and in your part-time, you go invent stuff, right?
This is the fun stuff.
This is the fun stuff, okay. Well, the fun stuff's teaching students. That's what you're supposed to say, John.
I enjoy that, too.
Okay. All right, IntelliRod is the name of a company you put together, right?
Yes, it is. Not
What is
just
IntelliRod?
myself. It's a startup that came out of the University of Louisville with myself and 3 other faculty in Speed School, Kevin Walsh in electrical engineering, Bill Natt, retired from mechanical engineering, and Mike Vore from bioengineering. So this is a project that you really need a multidiscipline team, and we'd be able to use everybody's expertise to develop this device that goes inside the body. The other founder is a renowned spine surgeon, Dr. Randy Puno with the Leatherman Spine Center. So the 5 of us basically Dr. Puno came up with the idea, and then the 4 engineers figured out how to solve the problem.
How to solve the problem. So what was the problem, and what product did you come up with? You come up with several, but what was the first one that got FDA approval?
Well, this one just got FDA approval a few months ago, and we've been working on this since 2000, so it just takes
that long,
so much time. Well, to get the funding, it's not just all FDA. It's get the funding, demonstrate it works, find customers that want to buy it, and then get the money to get through FDA approval. But it basically, the way it works is we developed this strain sensor combined with an RFID circuit that sits on a 1/4 inch titanium or stainless steel rod that these spine surgeons put in. There's roughly 500,000 of these surgeries done every year.
So is this spinal fusion? Is that what this is?
Spinal fusion.
Okay.
So it's for people with a very bad pain in their back that they can't figure out any relief, and this is sort of like the last resort, is to go in and just clear out the disc and fuse 2 vertebrae together.
Okay, so that's what I'm looking at. I'm looking at a piece of vertebrae or fake vertebrae, and it's got a rod in between 2 of the vertebrae and a little round thing here. That's the sensor that's on the rod here, right? The steel rod?
Well,
right?
This is actually the circuitry. This is
circuitry.
electronics that sends the strain information outside the
and
body.
So what's that do? What's that intended to do? How does that help the doctor, and how does that help the patient?
So the way it's really a whole new capability for these doctors, in that it allows them to know if the spine is truly being refused and how quickly it's going. Because right now, they using an MRI or CT scan cannot tell you the status of the bone. And what our device does is it measures that train or that transfer strain. When the device is first put in, that bone cannot support itself really well. And over time, the bone fuses and then becomes very strong, and all the support goes through the bone. So this gives them a quantifiable measurement of how that process is happening.
And the idea, I assume, is to tell the surgeon that this person either will or will not need future surgery to what?
That's
change the fusion or something.
The whole value proposition here, just because it monitors strain, is you got to do something useful for the surgeon or the patient, and in this case, it benefits both. In that it lets the surgeon know if that fusion process is successful. Right now, they don't know, and 10% to 20% of these procedures require second surgery. And they go in, look at it to see what's going on, and half of those, they don't do anything. They just suture the person back up. So hopefully this will prevent those unnecessary second follow-up surgeries.
Gotcha. We're talking with John Naber, who's an engineering professor at the University of Louisville and also an inventor of co-inventor, I guess, of several different products that are headed towards the marketplace. So is this being used? Is this actually being used in surgeries?
Right now, we have FDA approval of the disposable product, what we call Load Pro. So the spine surgeons, and we have trials going on right now with this device in various hospitals in Ohio, and we have here in Louisville and Norton's as well, in which the spinal surgeon will verify what the strain is when they first put in the rods and the pedicle screws to make sure it's an evenly distributed strain on both sides, and then they just throw it out. That's why it was relatively easy to get through FDA. The product we don't have FDA approval yet is the one we leave in the body to verify the fusion process. So that's what we're working towards. Okay. So right now we just have a disposable one that lets the surgeon know if they've torqued the screws, the pedicle screws, correctly. Okay. And then we have a third product which is also in sales now called iLink, that is a monitor for kids that have a brace, scoliosis patients, so that they it basically shows compliance, because if they wear the brace like they're supposed to, they can avoid the nasty spinal scoliosis surgery with lots of rods and screws to straighten the spine out, and a lot of them don't do that. So this device tracks how they're using it.
This is a tattletale device, isn't it?
Basically, I'm sure they don't tell the kids that we're going to know what you're doing.
But it basically tracks the amount of hours per day that the kid is wearing his brace.
Yeah,
right?
And hopefully avoid a very complicated, invasive, and risky surgery.
And so that does or does not have FDA approval?
It does.
It does. And so is that being used out there right now?
So we've got 2 devices that are in sales, but with the third one, the implantable strain sensor, we're still waiting on that one.
All right. So it's obvious what these different devices that you're making do for the patients and for doctors. What's it do for the University of Louisville? How's University of Louisville fit into all this?
Good question, Mark, because they have to get some benefit for this. So their benefit is they control the intellectual property. We've generated about a dozen patents from this work, and IntelliRod has signed an exclusive licensing deal where UofL gets a certain percentage of gross sales.
Okay.
And then UofL treats us well, too, because then they split whatever they get with the inventors.
Okay. Well, that's a pretty good deal for all involved, right? So it's great for you guys that are faculty members at the University of Louisville, and it's also great for, obviously, the University of Louisville to get some money off it, number one. And number two, it shows that you're developing all these interesting devices and discoveries at the University of Louisville.
Agreed. It's a win-win for everybody. In industry, though, you don't get anything. You just sign all your rights away to the company. So at the university, they're very generous.
And that's why you got into academics? You came from the
that wasn't the main
the
reason, but it was one of the benefits.
Again, we're talking with John Naber, who's an engineering professor at the University of Louisville, talking about some of his inventions that he and others have come up with. I really want to talk about the one for us, those of us who are getting a little bit older and long in the tooth here and may one day wind up at a nursing home. You've come up with a device that could help the care of patients in nursing homes. What is it, and how does it work?
I'm real excited about this one, too, Mark. We've been working on this, myself and research engineer Doug Jackson that works with me, probably since 2014, I guess, when somebody approached us with this idea, and we came up with a solution. And it really wasn't going anywhere until a group of entrepreneurs from Ohio approached us and had the foresight and the financial resources to take it to the next level, and that's what we have now. Is they've basically invested $500,000 to fund this work, and we are in pilot trials now, at least with the in-home version.
What is it?
So the device is basically a smart brief. So it allows
smart underwear.
Yeah.
Right.
It's better than, I guess, diaper, but yeah.
Okay.
So we can use underwear.
Okay.
But it will now give caregivers, CNAs, people in nursing homes as well as at home, information that doesn't exist. They'll let you know when a person has voided. It will track the time it takes to change the brief. A lot of these people can't do it themselves or anything. And it also measures temperature and position. So this is information that will just help improve the care of I would say mainly people in nursing homes. And as you're well aware, a lot of these nursing homes, especially like the VA, you hear about these horror stories about people having, don't get changed over 6 to 8 hours or more. And something like this will keep that from happening.
Right, and the biggest thing, I think, and I worked in a nursing home as a kid, was the bed sores that can develop when you don't change someone. They've gone to the bathroom. They can't obviously get out of bed. And nobody knows, well, Mr. Smith over here just went to the bathroom. He's been sitting in his own urine for 4 to 5 hours. That's not good. That's not good for his skin. So that's what this does. Is a sensor device, right?
Yes.
Does it have sensors inside?
It's a moisture sensor in the brief that gets tossed.
Mm-hmm.
And the challenge was to make something that couldn't cost more than pennies, basically. It had to be very inexpensive. So the moisture sensor is disposable. The temperature sensor and the position sensor are reusable with this module. It's the size of
it's like a pager, an old-fashioned pager.
Basically size of an old pager.
For those of you old enough to know what a pager is, right? For you 18-year-olds who don't know what a pager is, it's about the size of a garage door opener. I guess that's a good enough.
They probably don't know about that either because it's all programmed in the car now.
When you pull in the driveway, it automatically opens these days. But you think that's got some promise, right?
I do. I mean, when you look at the market of adult briefs, there's 10 billion in sales the last couple years, and if you figure they sell for about 50 cents a brief, you're looking at 20 billion briefs, and that number's only going to keep increasing as the baby boomers get older. And as you pointed out, the benefit is that sitting in when those wet briefs break down your skin, those bed sores then cause infections, and people end up in the hospital, lead to urinary tract infection. So by improving the care, can I think significantly reduce the hospitalizations of these patients.
Talking with John Naber, engineering professor at the Speed School of Engineering at the University of Louisville. All right, let's talk in general terms now about the city of Louisville and the University of Louisville. What are the things from your perspective as an entrepreneur and an inventor that we're doing right at UofL and in the city of Louisville?
Sure, we are doing some really good things, and what comes to the top of my mind is the support that entrepreneurs get. For anybody that has a great idea, I've always thought of a product, the support is there, mainly through GLI, Greater Louisville, Inc. They offer all kinds of free services. Lisa Borjornis is in charge of it. She's a good person to talk to. We'll get you set up with the right people, the resources you need. We've worked with Ellie Puckett related to the Vote Award, and they help get you mentors. They help provide you guidance. They point you in a direction for possibly getting funding. So everything an entrepreneur really needs to know to move forward, and they don't have that knowledge.
And you got the Launch It program at the UofL as well, right?
That is yes. That's through Mary at University of Louisville. I took that program about a year ago. I took the class. It's a 3-hour class for 9 weeks, once a week, and I wasn't expecting to really get a lot out of it because of the number of startups I've already been involved in. But they really taught me that something that I wasn't aware of with this concept called lean startups, and I've really taken it to heart. And what you really should be thinking of as a future entrepreneur is make sure you have customers out there that really like and are willing to buy what you have. Don't waste a lot of time building things and trying to line up capital and things like that. Really identify your customers, and that they do a great job teaching that.
So a lot of support, a lot of programming for entrepreneurs and those who were trying to get started with their own startup businesses. What does Louisville need to do better?
What I would like to see that we've struggled with the startups I've been involved in is actually getting the venture capital funding. There's not a lot going on here in Louisville, unfortunately, on that end, especially as compared to our regional peer cities like Nashville, Indianapolis, Cincinnati. All the funding basically from the IntelliRod startup came out of Ohio, and we've the later rounds we've had some luck getting funding from Chicago as well. The Smart Brief project with BioLink, all the money's come out of Ohio as well.
Yeah. Thanks for listening to UofL Today with Mark Hebert. Go Cards!